Welcome back to Curriculum Development and Early Intensive Behavioral Intervention. This is video part 2. Intervention includes using assessment and curricula to identify skill deficits and break down complex skills hierarchically into steps that can be taught one at a time for the purpose of enabling the child to use the skill independently and in useful ways in the natural environment. So this should sound very familiar because this is no different than curriculum development in a school setting or for the purpose of developing an IEP. Now the intervention accomplishes these goals by applying principles of behavior, maybe such as discrimination training. That's when you're establishing antecedent stimuli, SDs, with differential reinforcement. Manipulation of motivating operations, shaping, and chaining in the context of intensive database decision-making. Familiar stuff. Once skills are taught in a structured context, they are practiced often across daily routines and activities to ensure maintenance and generalization of those skills and enable the child to use their current skills to acquire new, more complex skills. So that's a really important part of early intensive behavioral intervention. Note that most of the time it's taking place at home. And so at home, there's only so much a therapist can do. They're only there so many hours a day. There's a child has much more to gain from ABA being embedded into their life throughout their day in everyday routines than just for ABA to happen when the therapist is there, right? So a big part of early intensive behavioral intervention is training caregivers to incorporate skills and interventions into daily routines and activities. Therapists or teachers meet frequently with team members, such as the BCBA, SLPOT, school psychologists, parents, other therapists, and other service providers to review intervention components, progress, select new skills to teach, modify ineffective programming, and for training purposes. So see, this early intensive behavioral intervention is not just a behavior analyst and their team doing work, but oftentimes a multidisciplinary team is working together to ensure that all of the child's needs are being met in multiple settings. So this unit is going to be a little confusing perhaps because I'm going to show you a lot of lists. And so like we've talked about before, lists are very handy, very helpful, very useful in practice. But when you discuss a lot of lists back to back, they can get confusing. So I'm going to show you this roadmap to navigate this unit, but it's not much of a roadmap because it's going to look like a mess. But nevertheless, I think it would be helpful to show you what we're going to focus on here. So the first thing we're going to do is we're going to look at 4 features of effective intensive behavioral intervention. Now those are treatment intensity, ABA, quality supervision, individualized curriculum. And then we're going to move to 4 steps linking assessment to curriculum. So the 4 steps are selecting a comprehensive assessment, conducting the assessment, deciding what to teach, and customizing the lesson plan or deciding how to teach it. And then we're going to expand on deciding what to teach and selecting a comprehensive assessment. So for deciding what to teach, there are 12 factors to consider, and we're going to go through each of those factors in detail. Okay, so 4 features of effective EIBI, 4 steps that link assessment results to curriculum, one of which includes deciding what to teach, and there are 12 factors. There are more factors than that probably, but we're only going to cover 12 factors to consider when deciding what to teach. But then when we expand on selecting a comprehensive assessment, there are 5 things to consider when selecting an assessment. That's choosing one or more assessments. In other words, are you going to use one entirely comprehensive assessment, or you're going to use multiple assessments that together would make a comprehensive assessment. We're going to look at advantages of comprehensive assessments, and then another consideration is going to be assessing skills from infancy to the client's chronological age. And then domains of functioning are important to consider when selecting a comprehensive assessment, as are the variables to consider, like additional variables to consider when choosing assessments. So when we expand on domains of functioning, we're going to look at those 8 domains: social, motor, language, adaptive play, executive functioning, cognition, and academic domains. When we look at variables for choosing assessments, we're going to go through 7 of those. Comprehensive scope, categorized by age, considers function, links to to lessons, identifies strengths and weaknesses of the client, tracks progress, and has or allows for flexible measurement methods. Okay, so this is our roadmap to navigate this unit. So we're going to start out in the top left, 4 features of effective early intensive behavioral intervention. Here they are. It's treatment intensity, ABA, quality supervision, and individualized curriculum. So let's look at treatment integrity first. You've heard a lot about this, so you know now it's extremely important. Now, and this is, that's a typo there. So it is extremely important, but we're talking intensity, excuse me. All right, so integrity, of course, is important, but that should say treatment intensity. Now, there are some folks who are going to say that the best ABA outcomes from early intensive behavioral intervention will result from 40 hours per week. Okay, some folks are going to object to that and say 40 hours is too much. Well, what we're going to go with, based on your assigned reading, is that before the child, there's a typo there, so it should just say before the child reaches school, a minimum of 30 hours per week of one-on-one behavioral intervention for 2 or more years is believed to produce the best outcomes. Now, it says a minimum of 30 hours, right, for 2 or more years. Now, something to note here is that means it's got to be, that is if it's high quality. If it's low quality, it doesn't matter how many hours per week of behavioral intervention a kid has. They're not going to make great progress or show great outcomes, right? So 30 hours per week of high quality one-on-one behavioral intervention for 2 or more years, that's going to produce the best outcome. At least that's what we think. Now, EIBI, again, must continue in school, and it cannot merely end because the child's older. The continuation of EIBI must be based on the child's needs and progress. Okay, not their age, their needs and their progress. Next are behavior analytic principles. EIBI must consist of ABA program. If a program that calls itself early intensive behavioral intervention is not using ABA, it's not EIBI, or it's not early intensive behavioral intervention. How do you know if it's ABA? It's ABA if the service or the interventions conform to the 7 dimensions of applied behavior analysis described by Bear, Wolf, and Riesly in 1968. That is, their applied behavioral analytic, conceptually systematic, effective, technological, and with generality. If all 7 dimensions are met, then it's applied behavior analysis. If it's ABA, it's EIBI. If it's not, it ain't EIBI. All right. Now, quality supervision is another. Now, the clinician or teacher, so this, what we're talking about here is, I mentioned EIBI should continue into school, right? And so this discussion includes clinicians and teachers. The clinician or teacher must be supervised by a practitioner with advanced training in ABA and extensive experience using ABA with a variety of children with autism. You cannot take classes in applied behavior analysis and pass a pass a certification and a certification exam and then go into school and teach using applied behavior analysis. You cannot do it. These classes will not give you the skills you need to use ABA. Someone has to train you directly in the field. They have to teach you your performance repertoire. All you learn in school through books and lecture and so forth is a verbal repertoire. You learn to talk and think about applied behavior analysis, but you don't learn how to do it. So you need someone with advanced training in ABA and extensive experience. Now, if you're a teacher using ABA, it's critical that you receive mentorship or supervision from another teacher with a BCBA or equivalent experience using applied behavior analysis to educate children with autism or even a district autism or behavior specialist with the equivalent experience. Okay. Now, unfortunately, this is the reality. The reality is that most teachers today do not receive that luxury. You must advocate for direct training and supervision from an established BCBA to become a competent ABA practitioner. There's no way around it. And so that's why I advocate so strongly for and encourage you to work in ABA service delivery settings while you're still an undergrad and get that experience. So that way you can transfer that performance repertoire into a classroom setting. Otherwise, you're on your own and you won't know what to do. Now, ideally, teachers who use ABA to teach children with autism will have had 1 to 2 years of experience working one-on-one with children with autism using ABA with supervision by a BCBA before becoming a classroom teacher, because you'll receive very little ABA training and support. Okay. Individualized curriculum. Curriculum must be individualized to the child to address excesses and deficits in all domains of functioning, and the curriculum must be balanced across these domains. Alright, let's do some ASRs. Actually, we'll come back to that. We'll wrap up this video part here, and we'll begin ASRs in the next video part.